Hello. Thank you for joining us today for a live conversation about COVID-19 in Idaho. I'm Audrey Dutton, health and investigative reporter for the Idaho Statesman. Since our last live Q&A last month, Idaho has confirmed the presence of 3 variants of the coronavirus, variants that scientists believe are much more infectious. And we are battered from a year during which more than 1 of every 1,000 Idahoans died of causes related to the coronavirus. But there is good news. More than 250,000 Idahoans have already received at least 1 shot of a vaccine. Many of our most vulnerable Idahoans are now fully vaccinated, and Idaho currently receives enough doses to vaccinate about 40,000 people a week. And with the new Johnson & Johnson vaccine, that number will only increase. So what's next? Are we in the home stretch? And what happens as schools reopen? Before I introduce our guest, I want to give a special shout out to the next generation of Idaho scientists, the human disease class at College of Idaho that is watching our webcast today. Your lives may have been turned upside down by this pandemic, but we're all behind you 100%. Idaho is lucky to have students like you who are interested in such an important topic. And now our guests. We're fortunate to have 2 experts in Idaho healthcare to help us make sense of what's happening. Dr. David Pate spent a decade leading St. Luke's Health System, the state's largest healthcare provider. He now helps advise Governor Brad Little on Idaho's pandemic response. He blogs at drpatesblog.com, and you can find him on Twitter at drpatesblog. Dr. Tommy Ahlquist, thanks for joining us. Dr. Tommy Ahlquist is a former ER doctor, the CEO of BVA Development, and the co-founder of Crush the Curve Idaho, a nonprofit that got its start with COVID-19 testing, but now helps to arrange vaccine clinics. Its first vaccine clinic started the immunization process for more than 1,100 people on Saturday. You can find Tommy on Twitter at Tommy Ahlquist. Thank you both for joining us.
Great to be here.
We have received dozens of questions from Statesman readers, so we're going to dive in soon to start getting those answered. They are fantastic questions, by the way. And please, if you have questions, leave them in the comments of this video's live streams on the Statesman's Facebook and YouTube pages. We are monitoring them live. So, as the moderator, I get the first question. I would like to ask, last month, you each gave the state a grade on its vaccine rollout. Dr. Pate, you said B or B minus. Dr. Ahlquist, you said D minus. What do you think now? And if you would change Idaho's grade, why? Dr. Pate, let's start with you.
Well, things are improving a great deal, as you already mentioned in your opening comments, Audrey. So I certainly would give the state credit. But as I said last time, really most of our problem was on the supply end, which is a federal issue, and the state really doesn't have much, if any, control over that. What has particularly helped is, I think, several things. One, as you mentioned, the supply has increased. We've got about double the supply that we had when we last talked, and it's expected to increase even more. In fact, it's a historic day that the Johnson & Johnson vaccine is being put in people's arms starting today. So that's good news. The second thing is the state, and I want to give the state credit for this, they have enrolled many more vaccine providers. And so having more organizations that can give the vaccine is really a tremendous boost to people. And then thirdly, you've, as I've watched St. Luke's, St. Al's, others kind of get into their rhythm. They're getting more efficient and doing larger numbers of people. And then, of course, with Dr. Ahlquist and Crush the Curve's effort to now add another site that can do kind of mass vaccinations, these are all very positive developments.
So what's your grade now, Dr. Pate?
I'd go A minus.
All right. How about you, Dr. Ahlquist? What are your thoughts?
Man, I wish I had Dr. Pate as my English teacher in college. I like that. I would have done better. Listen, just to recap why I said it wasn't for a lack of effort last time. I think it was a lack of communication and preparedness for what we knew was coming. And again, before I say anything, I want to applaud. With Crush the Curve, every day we interact with all the healthcare organizations and pharmacies, people trying. I'm very proud of our state for all the people that have come together that are working so hard to make this available to people. We were just overwhelmed with systems that allowed that to happen. And unfortunately, it's not worth dwelling on that. It probably could have been better, but it's in the past now. Let's just move on, because I do think my grade's gone way up. I applaud Governor Little. When that transparency, when he basically put the heat on people and said, hey, you got vaccines, get it rolled out. Because you remember, we were supply constrained, but the reason why we weren't getting more is we weren't using what we had. So it was a bit of a catch-22. And I think when he the transparency request that he made out there, and I think our utilization went way up, and that gave us more vaccine. And I'm very proud of the things that have happened all over the state. So I'm up to probably a B minus or a C plus right now. I do think one of the things that still really bothers us, and at Crush the Curve, I'll give you an example. So we found out last Tuesday there were 1,180 vaccines that would be wasted by a local pharmacy if they couldn't get out that week on Tuesday. And so literally in 4 days, we set up our first vaccination clinic. And Tina Upson, our executive director, comes from an industry that uses technology. So we quickly developed a technology that allowed people to sign up and get vaccinated. We held back intentionally 380 doses of that vaccine for Spanish-speaking only people, because I think that minorities and those that are not able to navigate the current system are being left behind. It's an interesting thing that happened when it was only Tuesday to Friday, but we opened that up, and of those vaccines we held back, only about 95 Spanish-speaking only as a primary language were able to be vaccinated Saturday by us. Now, it was a short runway. We had to go quickly, but the reason why my grade is probably not higher than that is we still have to figure out systems to get these vaccines into folks that aren't able to navigate the traditional systems. And I'll tell you, if you look at how when COVID hit last spring, it was those folks that really had they were at risk. They're on the front line. A lot of these are the meat packing workers and people that aren't going to be able to use traditional means. And so I think we still need to focus on that. I think Nicole Foy, listen, she's doing God's work because like every day she is paying attention to this. And I think she had an article that came out this afternoon that kind of shows the first look at data, and it's not pretty. So a lot of work to be done, but I applaud. If you think where we were a month ago, hey, I'd take it, Dr. Pate, going from a D minus to a B minus in just 1 month in any class I was in.
Yeah, thank you. Thanks a lot. I really appreciate that. When we saw the transparency website roll out, we could see what was happening with the long-term care program, the partnership with the pharmacies, and why that happened. The pharmacies offered some reasons, but we were able to see visually, oh, that's where a lot of our doses are sitting, and they've been able to get out more, and that's great. And yes, we do now have some demographic data on vaccines rolled out. And several readers asked how Idaho is helping people get access to vaccines, not only Spanish speakers, but folks who are homebound and things like that. So Mary Ann from Star wonders about appointment scheduling, but also transportation. Nancy, who lives in Boise and Cascade, wonders if there will be drive-through or mobile vaccination sites. Many folks who are mobile and motivated are getting the vaccine, which we're seeing in the numbers for sure. But what about those who are homebound, don't have family to help them schedule appointments, or have other barriers? How does Idaho get them vaccinated? Dr. Ahlquist, let's start with you.
Yeah, what great questions. So I think all of the real easy work is now, right? People that are just wanting a vaccine, have transportation, have a computer, have a way to navigate the system. That's what's happening now. Just to give you some real-time data, I checked this morning, every morning we're greater than 5,000 people log on to Crush the Curve website looking for a site. So we're still, and we're well over that this morning. So there's still plenty of people around the state that are looking for places to get vaccines that probably are mobile, can get to an appointment, can navigate. So I expect, and Dr. Pate hit on this, with this supply going up in the coming months, it'll be easier and easier for those folks. My question, and what I would be focusing on and recommending that we focus on, is what do we do today to start helping those people that can't do that? And so I think last week, from Tuesday to Friday, looking at just the number of Spanish speaking only people out there, if you start looking at people that are not mobile, there is going to have to be another solution developed now to help people that can't do it the traditional way. I haven't heard a lot on that, Audrey. My recommendation would be that we have got to do significant outreach. I know Tina went on all the Spanish speaking radio stations and offered up those 320 spots. There's need to be more of that. We're going to need to use the community organizers to get down into the folks and let them know how to get through. And then for those people that are not mobile, we're going to have to use our home health. Home health would be a great vehicle. I think of a couple of the big home health agencies in our state that do a remarkable job, by the way. Let's engage them and let them get to people with some of this vaccine. The question I would ask is, why wait till June or July when everyone that can do it's got it and then worry about it? Let's have a dual track and start answering some of those questions now. But I can tell you, I haven't heard a lot going on with that, and I'd like to hear a lot more.
Dr. Pate, do you know anything more about that?
Yeah, so several things. I think Dr. Ahlquist hit on some very important points. I think the first thing is we're in a race against time. And we have to get people vaccinated as quickly as possible. Certainly, from an efficiency standpoint, the kinds of mass vaccination that Crush the Curve is doing, St. Luke's, St. Anne's, a whole bunch of other organizations, that's the most efficient. Let's get lots of people vaccinated. And of course, everybody that we get vaccinated is making those people that don't want to get the vaccine or can't get the vaccine a little bit safer. So we need to do that first. Now, I agree. Then we've got to get out to folks. There's people without internet. How do they sign up for it? There are people like you mentioned that are homebound. How they can't come to us or can't come to us easily. How do we get to them? And we will work those things out. The big thing that is helping us is that was very hard to do with Pfizer and Moderna vaccines, given their handling, the storage requirements. It's tough to do low volumes where you have to drive around and get to people. So that's one of the beauties of the Johnson & Johnson vaccine. It's going to be far easier for us to do it. And given that they are more difficult to get to, that's another beauty, that they only need one shot and we don't have to do this twice. So it is going to come. That is an important group. But right now, I think the focus is right. Get as many people vaccinated as soon as we can.
Dr. Pate, can you give us a real quick, version of what the difference is between the Johnson & Johnson, Pfizer and Moderna, why it's one dose, and then what, should people choose one or the other, like if we have an option?
Yes. So they accomplish in the end the very same thing. They do it different ways. And since you asked me to be quick, I'm not going to get into the minor distinctions between Pfizer and Moderna. I'm going to consider them together. So they are what's called an mRNA vaccine, which means that it's a piece of genetic material that instructs a cell to make the spike protein. We've all heard about this spike protein now, which when you cause the cell to make the spike protein, then the body forms the antibodies and makes the immune response against it. So Pfizer and Moderna, what we do is we take that little piece of genetic material that codes for the spike protein. It doesn't code for the whole virus. So you can't get infected from this. You don't actually get COVID. You just get just instructions to tell the cell, make the spike protein. And that gets wrapped in some fat and it gets into the cells and the cells make this. The Johnson & Johnson vaccine is different. The Pfizer and Moderna are nuke types that we haven't done before. This one is a type we've done lots of times. And this is called a viral vector vaccine, which means we take a virus that is harmless to humans. It infects other people, in this case, chimpanzees, but it doesn't really cause any problem in humans. And in fact, even in chimpanzees, it causes a pretty mild illness. And we modify the virus so it can't replicate anyway and take off in your body, but it carries that little piece of genetic code and it gets in the cell. And again, just tells the cell, make that spike protein. So that's the difference between those two in terms of kind of how they work. Now, let me just address a really, really important point that you mentioned. Should people be choosing among the vaccines? They should not. And let me tell you why you should not. First of all, as I said, time is of the essence. We just need to get you vaccinated. Second of all, people look at some numbers that came out of their trials and say, oh, Moderna and Pfizer have a higher efficacy rate than Johnson & Johnson is. You don't know that. And I'll tell you why you don't know that. Pfizer and Moderna were tested against the variant that we've had in this United States for the last 6 months. We're not going to have that variant in several months. It's going away. It's going to be replaced. And guess what it's going to be replaced by? It's going to be replaced by a variant that we did test Johnson & Johnson against. And so we actually know how this vaccine works for what's coming. And we don't know about Moderna and Pfizer. We believe they're going to be effective, but they won't be 94, 95% effective against these new strains. So to compare them like this is the wrong way to think about it. Here's the key point. What we want to do is keep people from getting really, really sick, keep people out of the hospital, and keep people from dying. All three of these vaccines do a beautiful job of that. And you would be hard pressed to separate one from the other. So get whichever you can. Now, we're going to be changing this over time. And so, there's going to be boosters or there's going to be, it's not like you're going to get the one Johnson & Johnson shot and be done. There'll be something down the road, just like for the Moderna and Pfizer too. But for today, just get whatever you can. And I promise you, you're going to be way, way protected from really bad things.
Yeah, and from what I understand from talking with folks, we're likely to see a situation where the virus becomes endemic and we maybe get a yearly flu shot kind of thing that comes out. So
unfortunately, I think we've missed our chance to get rid of this virus. We couldn't get the cooperation that we needed, and now it probably will be endemic.
Well, I would like to piggyback off of the science discussion here and talk about the spotlight that this pandemic has put on the tension between science versus politics, public health versus personal choice. Both of you have been outspoken that you think voters should make their beliefs known at the ballot box as to the response that they think people should be taking to this, elected officials. Hannah from Boise asked, do you think it's more effective to educate and reach elected officials on these issues, or to educate and reach the voting population at large, if you have to choose? Dr. Ahlquist, you have run for office before, so let's hear from you first.
Well, thank you, Audrey. And that's a great question. Before I say anything, I'm sitting here listening to Dr. Pate. You will not hear anywhere in the United States of America or world, for that matter, a better explanation than he just gave very concisely about those vaccines. So thank you. I mean, it's just, I know you're hard at it. You research more than anyone I know. I follow you. I follow you as a physician. I just want to tell everyone, I'm grateful for Dr. Pate. We all should be, because it's truth, it's factual. He does the research, he puts it in a way we all understand. And so I just wanted to, I'm sitting here listening to you thinking that's just perfect. So back to
Thank
your
you,
question.
Tommy.
Your question's interesting in the fact that, boy, I think we need both. We need both. There has been so much misinformation out there. I'll tell my grandkids and their grandkids someday that remember this pandemic and what would have happened if it wouldn't have been a presidential election year. We'll never know that. But to me, now that we're seeing President Trump's tweets from last year, while we were gearing up, because we're reliving a year ago now, and I just think it set a tone for distrust between medical professionals and public health and elected officials like never before. It's unfortunate, but it happened. I will tell you that it's really sad to me because I know Dr. Pate and I, over our lifetimes, you're not used to, you go into medicine to help people. You study your brains out. You just work as hard as you can to be up on the latest and treat them well. And then there's the real personal thing where they come in and they see you and you take that knowledge and you have a real connection and you want to make their lives better. And so it's really strange in the middle of those feelings to have people second guess either the knowledge or the intentions or the reasons for public health or for suggestions. But nonetheless, that's how we find ourselves. We've come to a place in the United States of America where there are a lot of people that just don't trust almost anything that's said by medical professionals. And it's a new thing for us because in my career, and Dr. Pate, you could comment on this too. It's not a common thing. Usually you have that bedside manner, you look someone in the eye, you tell them what you know, there's discussion and then there's treatment and you're there to help them. So I think we need both. I think we need to continue to message to the people of our state and to the United States of America that science is real. There are caring professionals that are doing the right things for their patients and for their families and for us as a community in large, and listen to the science. And I think that's a very calm discussion. I've been involved with a few in the last few weeks where I think if you kind of walk people through slowly some of these things they've heard, you can unwind that and get them to a place of understanding and listen to their concerns as well. But then going to the politician side, it makes me frustrated to no end. And I express that all the time, that in a state where we are in a pandemic, listen, Audrey, someone ought to do a story on how much money has been dumped into the state of Idaho in the last year, but it's a lot of freaking money. It's so much money that we've got sitting here. And in the middle of that, right down there at that state house, who's talking right now, elected officials, about how to improve public health in Idaho and help our people? Nobody. And they're sitting on all this cash that's our taxpayer dollars or our kids' taxpayer dollars that were given to Idaho to help with public health. That's a shame. And shame on them and shame on us for not holding them accountable, because we should take this moment to improve public health, to improve the way we communicate and take care of our people, and we're simply not doing it. I think that David Pate and our frustration comes from a very genuine place, which is, we went into medicine because of people, and it's hard to watch politicians make decisions that don't help those people that we love.
Yeah, Dr. Pate, would you like to add anything?
Well, amen to everything Dr. Ahlquist just said. We could talk about this all day. Let me just add a few extra points. First of all, and you and I have talked, Audrey, we somehow have to help people probably during their education learn how do you discern between reliable information and questionable information, especially when Tommy and I were growing up. We had to, if we had a question, we went and pulled out the Britannica, the Encyclopedia Britannica, and looked it up. Now people go to social media and God knows who they're getting information from. We have to help people understand, if you want to know the truth, there are ways to find reliable information, trustworthy information. And so we need to teach people how to do that. The second thing is we've seen the power of words and actions on the part of our leaders. And we've seen how much damage they can do. And really the things that are happening in our legislature are just beyond the pale. I mean, just to the point of outrageousness. And, I think that the public needs to be told, while these legislators are coming up with all kinds of ways to put people in danger. I just now heard some legislatures behind some mask burning party today or something, some craziness. I think we ought to know, because I'm under the impression they're getting weekly testing. And guess what? They're getting testing you can't get, because they can get tested if they're asymptomatic. And guess what? Because of their privilege, they've already been vaccinated if they wanted to be vaccinated, probably. And so, yeah, it's real easy for them to say, well, let's do some crazy things because I'll get reelected and I'll probably be fine. But the notion that they don't care about the health and well-being of the people they represent, I mean, I find that shocking. I have always known that people would do things for political reasons, but I never really believed they would do things for political reasons in such a cold-hearted manner where they really just don't care if you get sick or die. It's quite disturbing. And so I guess if I were to answer your question, I certainly have had more success talking to the public and persuading them than I have legislators. But the problem is it's just immeasurably more difficult to persuade the public when legislators are telling them something completely different. And we have seen just some really terrible things. We had a representative telling people that doctors and hospitals are making up case numbers to get paid more. That is absolutely outrageous. If it were true, it would be a crime. And yet, who has called that representative to task and said, show us the evidence, show us the proof of your allegations? No one. And so it's a very bad situation. Now, it's all in well when you're dealing with a pandemic with a 1% to 2% case fatality rate. Guess what? Our next pandemic, we may not be so fortunate. What if we have one of the viruses known to have a 30% mortality rate and another virus known to have a 50% mortality rate? What if that is the next pandemic? These legislators have done irreparable harm in causing distrust. People are not going to know where to turn to. And while we haven't had much panic with this one, let me tell you, when it's 30, 50%, you're going to have panic. And then what are Idahoans going to do? It's a terrible shame.
Thank you for bringing up that. And just to be clear, there are viruses that have jumped from animals to humans that have 30 to 50% fatality.
That's exactly correct.
Those have not spread between humans yet. That has been documented, right?
That's right.
And that's the word.
We've got a case right now in Russia that a H5N8 influenza virus just went from an animal to a human. Now, we can thank God that virus has figured out how to go animal to human, but hasn't figured out how to go human to human yet. That's only a matter of time, especially if we allow ourselves to be lax and allow these infections to spread. And let me tell you, you get some of those kinds of viruses, we're going to be in a completely different situation. And so you're right. Yes, we can point to viruses that fortunately have had fits and sputters. The original SARS virus, this is the second one, the one that came before this. Fortunately, the efforts to contain that were successful and we got some good luck, but that mortality rate was close to 30%. So yeah, we really need to take this a lot more seriously. We're very lucky this time, all things.
Well,
Audrey, can I add one more thing just quickly?
yeah.
And I don't think we're just not, I mean, Dr. Pate and I, we're not just, we're appalled by what's happened, but also people say, well, what should they be doing? Well, it's really easy. Take the funding that came in, look at the holes in the system that were just exposed, and try to fix them and make them better. That's all, right? Look at the way the 7 districts healths work and how they communicate and how they're led and how, we don't scale things well in Idaho. So how do we improve response times and communication, and how do we take this extra funding that's here now to make us stronger and better? One of the things that one of my good friends said to me early in the pandemic is I said, what do you think about this? It's Mike Boren. And many you may know Mike. And he says, well, every time I've had a crisis in my life, I spend about 2 minutes panicked about the crisis. And then I say to myself, how do I take what I'm learning to make things better out the other end? And that's really all we're asking the legislature to be part of. We have some problems. We have some holes. You have dollars now. How can you help us make things better? But it's not even on an agenda. That's not even in these guys are so far behind, they think they're in first place. I mean, they're being lapped intellectually. They're being lapped by everything. And it's just frustrating to sit and watch because it matters in people's lives.
I think, too, that Hannah's question gets at a bigger issue, which is that folks are voting in legislators who are making these decisions because they believe in them. They want these decisions to be made. And what do you do to help people understand what the public health implications are of some of these things when they don't believe that that's actually the truth?
I will tell you, Audrey, I would disagree with you a little bit, because remember, I spent 2 years. I think I have a pretty good idea of the Idaho electorate. I think there are a few people that are they have blowhorns and they have podiums and they're loud and they push their beliefs on everyone else in Idaho. And there are those people that dominate most of the conversations and a lot of the legislation. I believe there's a silent majority in the Treasure Valley and in Idaho that is reasonable, wants what's best for our people, and understands that there is truth and science in the world. And I think those people need to be awakened, and they need to vote out the people that are doing this. And I think we're getting to a point where that will happen. I think people are getting tired of watching this, and I think we need to push back on the people with the megaphones that are really representing a vocal minority, because there are a lot of really good people. And I would tell the legislators that are in the Treasure Valley, that's the place to start. They would be the easiest ones to take out, because we do have a population of people here who care about people and want good health policy. And so the good news is there's a lot of them, and that's where we start. And then some of the fringe folks that come from locations that will never be voted out, that'll be more challenging. But we need to stand up and express our frustration and request solutions and help them make good decisions for our people.
Dr. Pate, did you want to add anything to that?
Yeah, I think Dr. Ahlquist is exactly right. And I would just add to it, if they think, well, but now we're getting to the end of COVID, 2 more reasons why they still need to vote these people out. Number 1, this won't be our last pandemic. Number 2, think about the damage being done to the state of Idaho in terms of future tax revenue, the welfare of our state, if we discourage our kids from going into science, from going into public health, from going into medicine, from going into nursing, what have you, because those are higher paying jobs. That's good for our state. And secondly, what are we doing to companies outside of Idaho that are thinking about relocating here or setting up something here? Do you want to open your business in a state where you know the legislature won't take a public health threat seriously? And you know what that means? That means my employees get sick. And if my employees get sick, then I can't operate my plant or my stores or whatever it happens to be. This is incredibly short-sighted. We have to understand there are consequences to these actions, and they're not good for our future.
Great, thank you. I want to switch over a little bit to the kind of mechanics of the vaccination effort. We got a flood of questions from people about what happens when the 16 to 64 age groups open up. Melody from Nampa said, my dad is 80 years old. His doctor advised him to go to Albertsons for the vaccine. However, Albertsons has no appointments available. Will all of the elderly people who want a vaccine be assured of getting it before the next tier of recipients open up? And then, of course, on the other hand, we've heard from people in that general population age group wondering, is it going to be just a swarm when this opens up, or when do I get my chance? Dr. Ahlquist, you have been involved in the supply chain side of this and the processes side. Can you talk to us about what you're anticipating when we have the new populations opening up? And then Dr. Pate, I'll ask you to talk a little bit about seniors and their expectations.
Yeah, so ideally, going back months ago, we would have had a clearinghouse that was electronic. You could have signed up for and then been assigned out to a provider in your area, right? I mean, that technology existed. It still exists. The state of Idaho is choosing not to do that, or I've heard that they might be coming out with a program, but that would solve the problem, right? If you could go on and sign up one time and then you were directed electronically where you're going to go. I mean, I don't want to, I'm trying to be Mr. Positive today. And so let me just leave it at that. That is a problem that is still sitting there ready to be solved. It can be solved easily. What they have chosen to do is say, hey, go figure it out on your own. So right now, if you look at the age groups and who's approved right now, everyone is trying to figure it out on their own. And I will tell you, there is still not enough vaccine for the number of people that need it right now. So I don't know how long it will take, but there's a lot of really positive things happening. And at some point, we're going to get to the point where everyone that is mobile, can navigate the system, can get in. And I don't know when that'll be, but hopefully in the coming weeks and months, that will happen. I do believe there is also something that no one's talking about. There is also a lot of capacity within healthcare systems, and Dr. Pate could talk to this. And through we have a lot of capacity. I don't know what happens when that surge of vaccine exceeds that capacity, because that could happen too, as the number of people that need it. So we need to be planning for all of those different things that could happen. But right now, it's getting more vaccine. Hopefully they can use technology to help people sign up a little better. Because if I'm 16 or 25 or 75, I should be able just to say, hey, I'm in line, tell me where to go. It's a zip code thing. Hey, based on your zip code, here's an available vaccine thing. I mean, there's rocket science, and then there's this, right? I mean, I grew up in Magna, and we could have figured this out in the gymnasium. This is easy to do. So we can do it at any time now, but somehow getting a system soon that allows people to do that so they're not double booking appointments. And we could talk about logistics for a long time. But I will tell you, with the tools that have been given to the providers, they're doing a really good job. We need a central clearinghouse, and we need to maximize those vaccines, which they're doing. And a lot of the questions or answers to those questions are going to be coming, because it depends on how we respond, right? I mean, we went from my mind D- to B-, but there's still a lot of work to be done to prepare for what you just asked.
All right. And Dr. Pate, what do you know about how likely it is that seniors are going to be able to get the vaccine before the pool opens up to everyone?
Yeah, so, seniors, anybody over 65 can get vaccinated right now. And my understanding is the state, because I don't work in this particular area with the state on the vaccines, but my understanding is that the state is monitoring it through all the providers about what that demand is, and that they're not going to open it up until that capacity begins to occur, because either we've vaccinated them all, or vaccinated all that want to get vaccinated. But so the person that asked you about their 80-year-old father, he can get vaccinated now. Albertsons, there's other options too. I don't know where this person lives, but you certainly can check the Albertsons. But there's other places, their local health organizations, and then in some areas, the public health districts are administering some vaccine, not in Central District Health, to my understanding. But there are other options. I really liked a website that the state came up that I saw a long time ago. I still don't understand why we didn't go forward with that. That would have given people the opportunity to do this. I do understand that there were some kind of issues, and now there's going to be a new one where you can sign up and then the providers can pull from that and then go to you rather than you having to be querying them all the time. I think it's imminent, but I don't know. I don't know if it's live now or we're going to be live soon. But I do believe that seniors will have an adequate opportunity to get in there to get vaccinated before the gates are opened.
Hey, Audrey, just one more thing on this. I think it's really antiquated, but we do have a little team that calls all around the state right now, Crush the Curve, trying to tell people where there are openings. And we've been overwhelmed with the thank you notes back from people, because I do think depending on where you are, and we have a big state geographically, they can check there every day, and just want to reassure them that we are on that, calling and trying to get that information out the best we can.
Thank you for that. That's vaccinateth208.com.
Yep.
Right. And just to follow up on what Dr. Pate mentioned, the state has announced that they'll be announcing a pre-booking kind of website on Friday, is my understanding. So I'm very eager to hear more about that. And the website that they were going to use was PrepMod. They decided not to use that one. There are a few providers who are actually using it to book their own things, mostly in North Idaho, but it is not functional currently for statewide. We got a good question from Jason Kettle on YouTube. Apologies, Jason, if I mispronounced your name. If the supply of vaccine to Idaho drastically increases in the coming weeks, do we have the capacity to administer those doses? Dr. Ahlquist, do you want to take a shot at that one?
I think we do. I think it would take a little work, but I think if you look at the capacity, when we talk to St. Luke's and St. Al's and us here in the Treasure Valley, I know Primary Health does a great job. I think we've got quite a bit of capacity till we hit that. And I think with what Crush the Curve did last weekend, I know in Eastern Idaho and North Idaho, that does not seem to be an issue yet. I do think there would be a point at which it might be. And I think maybe a better question at the end of that would be, okay, if we have enough capacity, then what happens when we try to get it to the little bit more difficult folks to get the vaccine? And it's another issue, but I'm encouraged by the capacity we have. If we could figure out the logistics and the scheduling, I think the capacity to actually put the shot in the arm, people have done an amazing job, right? Because then we're not dealing with government. Now we're down to private institutions that are used to performing to stay in business. And I think they're doing a remarkable job.
Dr. Pate, did you want to add anything to that?
No, I totally agree. We can handle much more capacity. And if the legislature won't be ridiculous and end the emergency declaration, then we also have the ability to have the National Guard help us with this. But I think the legislature is going to try to see if they can cut off our money, cut off our ability to use the National Guard, all kinds of ridiculousness.
Yeah, and as we were reported, FEMA also, through FEMA requests, Washington's been able to use NIFC, which is our Boise-based wildfire fighting planning kind of organization that fights literal wildfires, sending them out to help with planning out vaccination clinics, which is just a really interesting thing to do, right? Put out a figurative
Audrey, I think FEMA just gave the state, if I'm not mistaken, I might be off a little bit, I think it's somewhere $80 million this week too. This is not a money problem. This is a leadership problem. And so we're on a good path, but we just gotta have the right leadership to get us there.
All right, this question is going to go to Dr. Pate. Cade from Boise asked, do you ever see the hospitals filling up again like they did in early 2020 because of new variants of COVID, or are we past that stage? And of course, the hospitals in Idaho filled up in the fall. But do you think that we're past that?
I think so, but I wouldn't be willing to stake my reputation on that. And the reason is, Uh, another, Dr. Ahlquist and I have a lot of head scratchers, but another head scratcher is why we are so resistant to look to other parts of the world to see what is happening so that we can be prepared here. And it's just mind-boggling. I try to tell people about what's going on in some of these other countries that already have high levels of B117, which is the UK variant, so that we can be prepared for it, because that's going to be our predominant strain in a month. So it seems like you'd want to think about what's coming. I'm not getting any takers. Nobody seems to be interested. And what we are seeing in some of those places is that if you don't take that seriously, yes, you overwhelm the healthcare system again. And why I feel so much better is that in the first wave, we did get folks in our long-term care vaccinated. That's going to be the biggest relief to hospitals, because they're some of the highest risk to end up in our hospitals and take up that capacity. So that is good. And as I said, these initial vaccines look very promising that they're going to be successful in protecting people from those variants. But if everybody else just acts carefree and we do ridiculous things like Representative Crane just wants to, just however many people want to get together, that's all good. And there's no pandemic, just all come together. If we do crazy stuff and schools are now talking about, let's just bring all the kids back, even if we can't distance them, we're going to have problems. We're going to run into. So if our hospitals do fill up, it's going to be our fault. It doesn't have to be that way.
Audrey, I had one of my favorite basketball coaches, was a great coach, and he would say to us, "I've never seen a team better at snatching defeat out of the jaws of victory than you boys." And that's kind of where we're at right now, right? Is we're in the fourth quarter. If we just follow a few guidelines through this and just keep going and just not snatch defeat out of the jaws of victory, we can be so much better off as a community, as businesses, as schools. But it seems like we have an insatiable appetite for defeat in this virus. And boy, I hope we don't. And there's a lot of positive going on too, but continue to mass social distance. There's still a lot of people that haven't been vaccinated. As great as it is, the greater 250,000 people have, a lot of people haven't. We have these variants. So just, I would plead with everyone to just hang on a little longer. Everyone's tired of this. Everyone's tired of this. But we got to hold on a little longer so we can win this, at least this phase of the game, right? I mean, the war's not over, but the battle of getting into the spring and getting vaccinated, getting people where they need to be, we're close. So just keep listening and complying, and it will be worth it for you, your family, and your business.
And Dr. Pate, you've brought up on social media the fact that the variants appear to spread more easily in school settings too. And I just want to make sure that I give you an opportunity to talk about that a little bit to help folks who are thinking about going back to school. What should they be considering?
Well, thank you, Audrey. To be clear, I'm really just talking about the UK variant because it's the only one I have data on. I don't have data about the South African, the California, the New York, or the Brazilian ones in schools. So I just don't know. But even though it's early and we don't have a lot of great data, and there are some confounding factors that could mislead us, there's certainly a suggestion that the transmission characteristics of the UK variant are different. Now, hear me clearly. When I talk about transmission characteristics, I mean how it behaves when it is transmitted to somebody else. All of the protections that Dr. Ahlquist just mentioned, they work against the variants too. Mask, distance, washing your hands, all that stuff, that you do the same things. But the transmission characteristics look different. And what I mean by that is, and what's frustrating to me, is schools are making decisions for March or April by looking back at what we had. And let me tell you, schools did a great job. They were very safe, but that was with the prior variant, and that was with hybrid. And so part of the scientific method is you can't change all the variables, like now bring everybody back and decrease the distance and have a new variant and say, we'll get the same outcomes. Science doesn't work that way. And if we look at many different countries where they had the same experience as us with the previous variants, that it did not appear that there was a lot of in-school transmission. With this new virus, it does appear it may have a higher attack rate in younger kids than what we've seen before. And interestingly, if you look at the UK data and you look at one of the age groups that bumped up the most, because we still are not overly worried about the kids. Kids do well with COVID by and large. There are some tragic things that happen, but by and large, they do well. But if you look at the UK data, guess which age group had the biggest bump? Before, with the prior variants, the attack rate was 12%. With the new variant, the UK one, it's over 20. It's people aged 30 to 39. Why would that be? Those are the parents of these kids. And so a lot of these countries are now shutting down their schools. Now, we need to have kids in school. We don't need to have all kids in school unless we can distance them, but we need to have kids back in school. I'm just saying this is not the time to compromise on distance. It really wasn't the time even with the old variant, but it's certainly not the time to compromise on distance now. And there are ways to do this a lot more safely. The thing that's really mind-boggling to me, even though schools have asked for many of our opinions about what should be done, and they're not doing what our opinion is, that's fine. That's their decision. But you would think the next question they would ask is, okay, if we're going to do it the way we want, how can we do this the safest? No one's asked me that question, and that is the shocking part.
Yeah, wow. Okay. As a follow-up, Dr. Pate, to that question, Courtney Lynn Shaw asks on Facebook, do you see a spike coming after spring break?
I am looking at the data right now, and I am wondering if it's beginning right now. I can't say. I don't have enough data points. I'll know in a week, but I'm worried it's starting right now. And we've certainly seen that in many other countries. But yes, I expect a big spike late March, sometime into April, somewhere around there, because we'll have this new variant and we'll still have so many people that are not vaccinated that, yes, I am anticipating one more spike.
Well, we'll be ready for that. And Dr. Ahlquist, getting a little bit more general, Lauren from Meridian asks, what would you say is the most misunderstood aspect of COVID?
Oh, that's an easy answer for me. I think the most misunderstood is that somehow this virus in Idaho is different than the virus in Utah, is in California, is in Korea, is in, it's been, I know it's human nature for everyone to recreate the wheel and think that they're going to figure things out, but it's blown my mind since day one that our Idaho Department of Health, the districts, even our 7 districts, everyone's doing something different. There's no consistency in protocols. There's no scalability of solutions. And that's always been my biggest concern, is that we can just go look at what was the formula for success where people were successful. That formula was keeping the virus down. It's interesting to me today, we're in March 2021. We're not March 20 anymore. And no one even talks about surveillance testing anymore. We just had another $80 million dumped to the state of Idaho. And I promise you, you will not hear anyone in this state talking about how to do surveillance testing at our schools. By the way, we're doing surveillance testing in Massachusetts. We're doing it in Tennessee. We're doing it in Texas as Crush the Curve, but we're not even talking about it here because everywhere else is saying, hey, we're probably going to have variants. We're going to probably need to stay open. How do we have safe policies and procedures? But how do we test to keep it's not even talked about here. It blows my mind sometimes how we're back-assward we are in our thoughts when we have solutions around us. So that's an easy answer for me.
Dr. Pate, what do you think?
Yeah, I think that's the most frustrating thing, is that we just can't learn from others. And it really goes back to the point that I was making before. I'm glad you gave that to Dr. Ahlquist, because I was thinking of so many potential answers to that question.
We could talk all day, Audrey.
Yeah, I've got some things too that I've been recurring fact check issues. Lindsay from Garden City asks, and I'm going to make this the last question because it's a hopeful one, and I will leave this on a hopeful note. Lindsay from Garden City asks, with the number of cases dropping, given we understand there could be another spike, what is the best estimate for the end of the pandemic in Idaho? What do you think? Dr. Pate, you go first.
So rather than setting a date, let me tell you how we'll know, what we can follow to know when we're going to get an end to this. So the first thing is the percent of our population that's getting vaccinated. That's going to be the biggest predictor. At this point, there's no way for us to get out of this other than vaccination. And even that, like we talked about before, it may mean an ongoing strategy. But, we still don't know what it takes for herd immunity. One has to imagine that if these variants are more contagious, and certainly the European CDC says that they've concluded that is the case, that will raise the percentage of people that have to get vaccinated to hit this magical herd immunity. We've got a couple of problems. In Idaho, we have a fair number of people that are hesitant. I'm optimistic about them, especially if I'm right and we do have this next surge. I think that's going to convince a bunch of them to get vaccinated. But we have another group of Idahoans that just says, no, not getting a vaccine. That's just going to mean, interestingly, they're the same ones that are complaining that their kids aren't in school and that they can't go to games and stuff. Well, the answer is get vaccinated. But so we're going to have that group. The second is it's going to be summer before we can do kids that are adolescents, that we can vaccinate them. We're not even going to get to young kids till next year. And kids in Idaho are something like 23.6% of the population. So we're not getting to herd immunity this year. However, the way that, as from public health standpoint, how we can know when we can start easing off some of these restrictions is just follow that one number, the daily new cases per 100,000 people. And what you want to do is see that just keep on going down and down and down. And when we get down into the level of like 1 or so, we're going to be at the point where we can have serious discussions. We're nowhere clear. Let me also just say, and then I'll turn it over to Dr. Ahlquist, the herd immunity is not just Idaho. Remember, there's lots of people that love to come to Sun Valley. Lots of people that like to come to McCall, lots of people that like to come to Coeur d'Alene from out of state. And guess what? They'll bring whatever they have with them. And so it's not just us. We need everybody to get immunized. And we're not even, some of the foreign countries, we're not even going to get immunized for a couple of years. When you talk about normal, if you mean international travel, that's going to be a whole different thing. So, but we'll get to some sense of normalcy probably this fall, but we have to keep our guard up, because the more we allow this virus to transmit, the more variants we're going to get. So far, I think we're lucky with the variants. They're bad, but I think the vaccines are going to work. I may not be saying that to you 6 months from now. So we've got to stop the transmission. That's why we just, like Dr. Ahlquist said, if we could just pull together for the next 3-4 months or something, let's just get this way under control. Wow, we'll get back to normal a lot sooner.
Thank you. And you hit on something that a few of our readers also asked about, which is when can I expect children to become eligible? And it sounds like summer for adolescents, next year for younger children.
Yeah, I think we have to do these studies in stages. So right now, we're looking at kids roughly like 11 to 18. I think right now there's one vaccine we have that's approved for 16 to 18-year-olds. That's the Pfizer, so they can get that one. But I think the 11 up probably this summer, early this summer. We might get to 5 to 11-year-olds, maybe at the end, towards the end of the year. Younger than 5, I think that's next year.
And as the parent of a soon-to-be 3-year-old, I am watching that closely and hopefully. All right, Dr. Ahlquist, what do you think? When can we expect more normalcy?
So not a lot to add to that. Excellent answer. The only thing I'll say, it's all about the variants, right? Because this thing kind of went crazy in the United States, our chance of not having it be about the variants is over. So now it's about the variants. I think I would like to end on a lot of optimism, though, is that our healthcare workers are vaccinated, everyone that wanted it, our teachers, our elderly, those people that were so vulnerable during this. So there's a lot of really good reason to be hopeful now. I think the time of year is also a good thing. I think we will have another spike, but there's a lot of reasons to be optimistic. I would plead with all of our listeners. You're going to have some listeners that are saying, "Oh, those two kooks are on again, talking about trying to scare everyone. Why these guys just stop it?" There are a few of those people, but there are a lot of people out there that are concerned about others. And if you could just help others understand a little bit more, there is a lot of reason to be optimistic. We have a great medical community. We have Idaho is built on this can-do heritage of hard work and coming together. And then there's a bunch of people that are out there. And I think if we just rally together those you can and try to stick through this, we'll get through it. It's going to be the new normal. We're going to have variants. We're going to have to deal with this for years to come. But I applaud all the work that's being done. And it's nice, again, to be on with my good friend, Dr. Pate. I learned so much, and I think his answer on the rest of it was spot on.
Great.
Thank you.
Thank you both so much. Thank you, Dr. Pate and Dr. Ahlquist, for talking with us today and sharing what you know. And thanks to our viewers for joining us and for asking such great questions as always. You can find more COVID-19 coverage at idahostatesman.com/coronavirus. I'm Audrey Dutton, health reporter for the Idaho Statesman. You can support our work covering the pandemic and support community conversations like this by subscribing to the Statesman. You just go to idahostatesman.com/subscribe. Thank you so much. Stay safe and healthy.